what is laryngectomy is the removal of the total larynx, the vocal cords along with the upper part of the trachea. First sequelae, loss of voice. Second, a permanent stoma for you to breathe, that you don't have smell because you're not breathing through your nose. So these are all the sequelae of laryngectomy. That is the reason why they shifted to radiation as a treatment of choice. With recent advances, we have started using laryngeal prosthesis and electrolarynx. Hi, I am Dr. Avinash Chaitanya, head and neck surgical oncologist. Today I'll be telling you about an interesting fact. Basically, laryngectomy, that is total laryngectomy, was the gold standard of treatment for carcinoma of the larynx, and it still remains so. But people have slowly moved towards a more conservative treatment in the form of chemotherapy and radiation. Reason being the complications and the sequelae of laryngectomy. Basically, what is laryngectomy is the removal of the total larynx, the vocal cords along with the upper part of the trachea. What are the sequelae of doing such a surgery? First sequelae, loss of voice. Second, a permanent stoma for you to breathe. And then one of the complications that happens is that you don't have smell because you're not breathing through your nose. Your nose will always keep watering because unless you breathe through your nose, the air will not push the secretions backwards and it will get it outwards here. So these are all the sequelae of laryngectomy. Permanent voice loss is something which most patients do not agree to. So that is the reason why they shifted to radiation as a treatment of choice for early laryngeal cancer. Now, with recent advances, we have started using laryngeal prosthesis and electrolarynx to have an artificial voice which can mimic our original voice and give the patients a chance to communicate after laryngectomy. Use of laryngeal buttons or caps can be done to cover the stoma so that nothing goes in and they are able to speak along with the prosthesis. Apart from these sequelae, which are going to happen in all the patients, there are some complications that are very common in laryngectomy. The most dreaded and the most common one is a salivary fistula. Basically, after removing the larynx, we have to sew the pharyngeal wall together so that the patient can eat through the mouth. When there is a wound infection, or if the sutures are loose, or there is a lot of saliva that is secreted, or excessive movement of tongue, which can happen in any patient, that causes a fistula or a leak or the giveaway of the sutures, which can cause saliva to trickle into the wound and cause wound infection, and sometimes it can cause total opening of the wound and long term complications. And most of these complications are enhanced when the patient has received radiation prior to the surgery. In post radiation patients, there is always a chance that there is a decreased blood supply to the pharyngeal wall, and also the thickness of the pharyngeal wall is less, the pliability or the elasticity of the pharyngeal wall is less, and that causes giveaway of the sutures. So in most of the patients who have received radiation, we tend to give a muscle flap or a more vascularized tissue to cover the pharyngeal closure, and that causes loss of ability to speak later on with the prosthesis or with the electrolarynx. So it is very important to judge the pros and cons before doing a surgery or going for radiation at the initial step. Most of the times, if we are giving radiation in a T3 and above lesion, there is a high chance that the patient may end up in having a dysfunctional larynx. That is, the larynx is preserved, but it is not functioning. The cartilages may necrose, causing foul smell. There could be, that is called ORN, and there could be also a residual disease for which we have to do salvage surgery. So with increased knowledge and increase in the number of cases that we are doing, we are able to fine tune the treatment options, individualize the treatments, and give the correct treatment to the correct patient we are able to determine who is going to have what complications and what surgery or what treatment would be more beneficial to them. So be very cautious about choosing your first line of treatment and cure yourself at the earliest.